Don't go away. I'm going to bring you Dr. Tom and of course, the participants exercise to condition their body for 3 to 4 weeks.
I am Dr. Paul Alexander. I am the specialist surgeon here at Pacific International Hospital, and I am basically a general surgeon. I do endoscopy and keyhole or the laparoscopic surgery here. And I've been associated with Pacific International Hospital for the last 6 years now. Today I'm going to briefly talk to you about healthy bowel. So when you talk of healthy bowel, what you're talking about is a bowel movement which can be 3 times per day or 3 times a week. And having a healthy bowel is part of the well-being of a person. And there are various factors which affect the person having a healthy bowel movement. And it could be lifestyle mainly. It could be diet, it could be the stress, it could be smoking or alcohol consumption or some of the medications what they take. All these can affect the bowel movements. So this is one of my patients. We did endoscopy here at PIH, and so as you see, that is the rectum we are entering the patient. So this is how the large intestine looks inside. This is how we go inside. We keep screening it, and as you can see the bowel which was collapsed with air insufflation is opened up, and if you see whatever fluid which is there, we remove the fluid, we suck it out, and we proceed. And if there is a tumor, as I told you, and if it looks malignant, we take biopsy of the tumor. And if we find one tumor in the proximal bowel, in the large intestine, we don't stop with that. We screen the entire large bowel, because there are a condition where you can have 2 tumors at the same time. So now I'll take you to our endoscopy suite and explain briefly about the endoscopy we have and how we perform an endoscopy and what we do there. See, this is our endoscope machine. This mainly has a camera, a light source in a single unit, and this is the actual scope, the fiber optic scope, and this is a monitor. People who have altered bowel habits or bleeding when they are excreting, unexplained weight loss, or if somebody comes with a swelling in the abdomen, and when we want to evaluate them, screen them, okay, they undergo this procedure. So let me talk to you about this scope. I'll show you, explain to you about the scope as such. So I've already put the machine on. You can see the light source is on. So these are all the wheels where I can control the scope. So this is a up, down, or a right and a left motion. Okay, and then these are various other adjustments used to make the scope either rigid or flexible for certain areas. So this is the suction port, and this is for air insufflation and water insufflation. So I'll just show you, like, can you see when I'm pressing this, there is fluid coming out. So when we're doing the procedures, there are certain times we need to flush certain things, clean up certain things, and if the camera can come close, where that is the light source, and there is another channel where we can actually introduce. If you see here, I'm just opening this. So this is the biopsy port, where I can show you the how we actually take a biopsy. I can demonstrate to you. This is the port where we put in the biopsy forceps and how it comes out. I can just show it to you. I can see. Can you see it? See how I introduce into the biopsy forceps. So this, once we have made a mind where if we localize the tumor, and then if you want to take a bite out of the tumor, this is how we need. Can you open, sister? Can you see that? The mouth opens, the biopsy, and then close, then we go, then close, and then we pull this out. And then we bring this out, and this is where the tissue will be, which is taken and sent to the pathology lab for testing. So I urge that this is one of the best screening equipments to diagnose cancer, both the upper and the lower GI cancers, and we should make use of this facility to diagnose. So when we talk of lifestyle, we talk of exercise, diet, and diet. When we talk of diet, there are we suggest to patients to take more roughage, more fiber diet, and the other most important thing is your fluid intake. Normally we expect at least 1.5 to 2 liters of fluid per day, roughly around 6 to 8 cups of water. So if you don't keep yourself well hydrated, then there is more chance that you get constipated, and you tend to develop problems, and then when you keep straining to excrete, then you end up having other problems like fissure or hemorrhoids and other surgical problems.